The first step of the patient journey is the first contact. The first contact with a patient always starts with a phone call. Always answer the phone with a smile. You can always tell when you're happy to talk to the patient. This is when you'll begin to start a rapport with the patient. You'll build your relationship by empathizing with them, asking them personal questions, and always calling them by their name. You'll use the phone scripting to find their chief complaint. From there, you will let them know if they are in pain, they can come in immediately. Let them know that we are able to take care of their treatment all in the same day, so they only have to come to us once. At the end of the phone call, remind them what your name is and let them know you're excited to meet them in person. The next step is the face-to-face. When the patient walks in the door, welcome them with a smile. If possible, greet them by their first name and let them know how happy you are to see them. Remind them if you were the one that spoke with them on the phone. Compliment them and let them know you are so excited that they are here. The next step is seating the patient. When greeting the patient, let them know who you are, shaking their hand, and letting them know you'll be the one seeing them today. Offer the bathroom prior to heading back to your suite. When they sit down, offer them a blanket, to turn on the TV, anything to make them more comfortable. And let them know you'll be there to answer any questions or get them anything they need throughout their appointment.
The next step in the patient journey is setting the stage. This is where you're setting the expectation for the patient and what they should expect during the appointment. This is where you're going to review medical history and take the blood pressure. Also talk about the head and neck exam. It's also a great opportunity to find out what their chief complaint is and what brings them in today. Other information to gather during this time is what's most important to the patient in their dental care. And finally, ask them if they're happy with their smile. The next step in the patient journey is pre-assessing. Pre-assessing is when we're gathering all of our diagnostic information, pictures, x-rays. Once we have all that information, we review our findings with the patient to let them know what the doctor might recommend as far as treatment goes. This is also the perfect opportunity to gauge their anxiety, their sedation interest, maybe their dental knowledge, and their acceptance rating. We also want to continue to get to know the patient and their dental knowledge in this step. The next step is introducing the doctor. This is the stage that helps build the doctor's credibility in your own words. We want to emphasize that we are group practice and all doctors are highly trained in all aspects of general dentistry, and that we always try to keep as much of our dentistry under one roof. This is a perfect time to share a personal experience that you may have had with one of our doctors at Better Dental.
Meeting the doctor. This is a really important part with the exam process. What you want to do is after you've gathered all the information, IOPICs, x-rays, anything you've gathered information where they have a concern, if they have pain, any dental goals that they want to meet, you want to have that all gathered. And then when you meet the doctor in the office, you inform them of all the things that the patient, what's going on, maybe if they're fearful, anything that you've gathered prior to. Come up with a tentative plan for their treatment plan through the IOPICs and x-rays. And then when you bring them in, introduce the doctor first, and then the patient saying, for example, Dr. Nadella, this is so-and-so. That makes it about the patient, and that's what we want here at Better Dental. After you're in there, it's a great time to create urgency with anything such as if they need to build up crown and there's something close to the nerve that might be a possible root canal, let them know that so they can start gauging when they want to schedule their appointment, how they're going to work it into their lifestyle. Also a great thing to do while you're in there is mirror the patient. When you give them a lot of different options, when they're missing a tooth or kind of different things, they get really confused. So it's a really great idea to mirror them and say, hey, if this was my mouth, this is what I would do. Treatment planning. This is a crucial time in the patient journey. This is where you want to get with the patient and the doctor, figure out what the main concern is, and make sure you're phasing it out properly. Whether we do it all in one visit under IV sedation, or we have to phase it out tooth by tooth, whatever fits into the patient's lifestyle. But this is an important part where you can grab a treatment coordinator if needed. Also, you can address the three main things or reasons why patients don't come to the dentist, and those are fear, financial, and lack of understanding. We have sedation for the fear. We have finances where we can use a TC anytime we need help with that. And then also lack of understanding, we can use our IOPICs, x-rays, and then any models or anything we can use to educate them and let them know about their situation and what's going on in their mouth. This is also a time where you want to create urgency yet again, not just when you meet with the doctor and meet in the office or in the operatory, but also during the treatment planning. If a patient has a build-up crown, possible root canal, you want to remind them of that and let them know time is of the essence. If they get to it soon, they may not need the root canal. And then also make sure you keep in mind their long-term goals, phase it accordingly, and make sure they leave with at least a recare appointment or maybe a recare appointment as well as a next phase of treatment appointment. Patient cycle. This is where you want to finish the appointment and make sure they had a Better Dental wow experience. You want to make sure you fill out your router completely so that there's no confusion from the back to the front staff knowing what we did that day. Also, make sure they leave with their next appointment scheduled, whether it's their next prophy appointment or their next treatment appointment or both. Also, make sure they leave with a new patient goodie bag or their 6-month recall goodie bag. Make sure you wow them the Better Dental way in closing. Make sure you personalize it your way. Let them know, hey, can't wait to see you in 6 months to hear about the kids. Build the relationship. That's the most important part.